Seth Spindle with Texas Women's University. Want to perform a manual muscle test on you. The purposes of this assessment is to test your muscular strength in certain planes to determine if it affects your function or not. Do I have your permission to continue?
Yes.
Okay. The groups that we'll be testing are horizontal abduction and adduction. So I'll ask the patient to assume a prone position. We'll start with horizontal adduction. The two muscles being tested are middle trap and rhomboids. So I'll use my left hand to stabilize the scapula. Ask the patient to move through the range of motion. So if you'll lift your elbow up, bent at 90 degrees, and move your elbow straight back up towards me. Good. And relax. Now I want you to move halfway through the range of motion, and I'll apply resistance at the distal portion of the humerus. Ready, go. Don't let me push you down. Good. The patient achieves 5 out of 5 muscular strength in this range of motion. Something that horizontal abduction may be used for is maybe to put your coat on when you reach back. So to test horizontal abduction, I'll have the patient move into a supine position. So he'll be on his back. We're going to test the right side again. We'll stabilize at the trunk, the elbow bent at 90, and resistance is applied to the distal, to just proximal of the elbow or the distal portion of the humerus. So I'm going to have the patient move forward and across his body. I'm going to apply resistance. Ready? Go ahead. Good. The patient once again achieves 5 out of 5 muscular strength, and an activity that this range of motion may be used for is to open a door. This next manual muscle testing will be performed on scapular depression of the right arm. So the patient's already assumed a prone position. Stabilization's already provided with the patient laying down. You'll provide resistance at the lateral aspect of the scapula. So I'm going to ask the patient to lift his arm off the ground and raise his shoulder toward his ear and back down. This time I'll apply resistance. So if you'll raise your shoulder back towards your ear. Now go ahead and push down. I'm going to give you resistance. Good. Patient achieves 5 out of 5 manual muscle test on this range of motion as well, and that's testing the lower trapezius. An activity that may utilize this muscle is propelling a wheelchair. We can perform manual muscle testing on wrist flexion and extension of the left arm. We'll start with wrist extension, so the patient is in a pronated position. Stabilization will be provided at the distal aspect of the forearm, and resistance is applied on the dorsal aspect of the palm. So I'll ask the patient to move through the range of motion, up and down. Good. I'm going to apply resistance. Go ahead and try to move. Good. The patient scores 5 out of 5 manual muscle testing. The muscles tested include extensor carpi ulnaris, radialis brevis, and radialis longus. An activity that utilizes this motion is using a pen, handwriting. So moving into wrist flexion, the patient will supinate. Stabilization is provided at the same spot at the distal portion of the forearm. Resistance is applied to the palmar aspect of the hand. So I'm going to ask the patient to move through the range of motion. Good. I'm going to apply resistance. Go ahead and try to move. Good. The patient again scores 5 out of 5 and no further occupational therapies indicated. The muscles tested include flexor carpi radialis, flexor carpi ulnaris, and palmaris longus. An activity that may involve the use of these muscles is self-feeding.